Hello. Good afternoon. I'm Dr. Avinash, Consultant Pediatric Surgeon at KIMS Cuddles, Secunderabad. I would be joining by Dr. Yoga Nagendhar shortly. So we are going to start this live session on children safety during Diwali. So children safety, when it comes to children safety, it is of utmost importance. So there is no doubt about it. But how safe are children with the crackers or these fireworks? Are they really safe, or do we need to avoid them, or can we go ahead with these firecrackers with certain tips? As we all know, during these festivities, as Diwali is coming, so children are more enthusiastic and they are more fond of these crackers. So we cannot avoid them. I do agree, but since it is unavoidable, we can take some precautions and we can have some first-hand knowledge regarding these safety concerns with the firecrackers, and we can go ahead with that. So fireworks safety, if you come across, it is a worldwide problem, not only in India where we do these firecrack works regularly during festivals. It is also seen throughout the world. So how big is the problem? That is the magnitude of the problem. And who are injured? And what type of injuries are seen with these firecrackers? So what are the prevention tips? This is the overview of our discussion today. So magnitude of problem, there are in each year, every year, thousands of injuries do happen during these festivities and sometimes also non-festive seasons. Accidentally, or sometimes they are careless. They can be directly involved or indirectly, because they might be a bystander also during the firecrackers session. So malfunctioning of these firecrackers and careless attitude during the firecracker fireworks can cause this problem. Who is injured? So since our discussion is more towards the children, yes, generally firecrackers are, most of them are done by these children, and there is a certain age group, that is around 10 to 14 years of age is a very liable age where such mishaps do happen. Boys, as we know, they are 3 times more prone for injuries with these firecrackers compared to girls. And as I told, 10 to 14 years is the major age group where a lot of these firecracker mishaps do happen. So types of injuries, most frequently burns, that is burn injuries are the commonest of all injuries happening during these firecracker workers. So if you consider burns, these burns happen mainly at the hands, face, and sometimes eyes. So these three areas are of utmost important and they are most commonest where the burns do happen. Along with the burns, we have inhalational injuries, that is when these children, they inhale a lot of smoke and fire, or they are very close to these fireworks, and they accidentally inhale a lot of smoke as well as fire indeed. So inhalational injuries are also very common. And noise induced injuries, these are actually not spoken much, but this do happen, since in this era what we are seeing is a lot of noise pollution because of traffic and all. So the baseline sound seen in our environment is already high, and these firecrackers, they do add to this noise pollution and they may cause permanent as well as temporary disturbances as well. So noise pollution, as I told, is a silent killer, and noise related ear damages can happen. They may be temporary or permanent. Sometimes there may be eardrum ruptures. Sometimes there may be tinnitus, that is a constant ringing sound heard in the ears. And most of the times what happens is the pets as well as elderly age group are concerned with this noise pollution during this firecrackers season, which are manifested by lack of sleep, increased blood pressures, and also pets, they do get affected with these noise pollutions. So if you take our acceptable noise levels considered are 120 decibels. So 120 decibels is as per the norms, it is accepted. And recently there have been revised, these crackers have been revised with their noise sound levels. If you can, a few examples if you can see on my slide. There is like most famous green color atom bombs. Nowadays it has been revised. Previously when we were kids, those bombs were literally very loud, and now they have been revised, and as they all now come into the acceptable limit. So these, for example, these atom bombs or these hydrogen bombs are considered, they come under 84 decibels, and there are a few other ones like shots and all these different types of crackers what we get nowadays, they go up to 117 and 120 decibels as well. To have a rough guide, for example, if you can stand away 100 meters from a jet engine, once it is switched on, it is generally around 120 decibels. So now you can understand how good an impact of these firecrackers can happen to the noise environment. So as I already told, inhalational injuries are, though they are not very common, but they are little worrisome. And most of the times what happens, they cause a lung injury. Lung injury may be directly because of the fire or as well as the smoke. So children who are suffering with respiratory ailments can sometimes are more prone to these inhalational injuries, and they may have a serious impact on their future health as well, and also in the pre-existing condition as well. So what is the best thing to prevent these inhalational injuries? Though I will be talking in detail regarding the prevention tips, but few aspects to keep in our mind is avoid large smokes. See, wherever these children, they see these fireworks going on, they tend to go into these fireworks and go into these smokes. They are excited with seeing the smoke and all, but prevent these children to go into the smoke as well as these fumes. And let the children wear protective gear like large goggles and proper masks. N95 masks are preferred, and better to avoid going into these, and have minimum gap between these crackers, since these children are very mischievous. Sometimes they tend to burst the crackers immediately, like 1 and 2 by the side itself. This causes little more chaos, and as well as there are more chances of children getting injured with this. So ultimately, whatever happens, it is the parents' responsibility, because the child, they don't understand the scenario, and ultimately the sufferers are both the children as well as the parents. So parents' responsibility is the prime most aspect to be not forgotten. And the children should be always under the guidance of parents throughout these firecracker sessions. So coming into managing these injuries, so first, as I told you, the burns, that is 50% of the injuries are burns, which happen to the face as well as the hands and other parts of the body. So burn management is of utmost importance, because before we go into the burns management, it is a small first-hand knowledge should be there for all the parents as well as the children, that the burns are classified according to their degree, that is the level of skin that it gets involved into the first degree, second degree, and third degree. First degrees are generally milder versions, and they just we can wash away with just redness as well as small blisters. Whereas the second degree and third degree, they are little deeper wounds which go into the tissues, soft tissues, and they require surgical care, as well as sometimes hospitalization also. And along with these burns, sometimes bigger firecrackers which have major potential for causing harms, like larger bombs or rockets and all this, they can have sometimes, very rarely, blast injuries as well. So these blast injuries can sometimes cause disfiguring of the hands as well as the face, so which is all can be avoided, and we don't want these type of injuries to happen. So coming to how to manage these burn wounds, like the less the contact with these crackers as well as the burns, the less time, the the less time of contact, the lesser the injury happens. So always try to move away from the fire as well as these firecrackers when they are burning. So best thing is to avoid, but sometimes they do get burns. So what should we do? First thing to do is just wash the wound properly. So wash the wound thoroughly, because there are a lot of chemicals which are in the firecrackers, which cause a lot of chemical reactions as well. So first clean the area with water thoroughly, then we can apply some antiseptic lotions. If they are extensive, then yes, definitely we need to uh, go see the doctor immediately. So as I already told, the first aid is a very important thing. So first aid, everyone should know. All the parents should be aware of this first aid. So when there are small burns which can be managed at home, so first wash the wound thoroughly, then apply some antiseptics and as well. And third thing is, you have to visit a local doctor if you feel the burns are extensive. So eye injuries, most of the times when you think of injuries, the first thing which comes is the eye. So more than the burns, we are more afraid of the eyes, because these are the sense organs which, just imagine one day without an eye, it is generally stressful to think of also. So whenever there are eye injuries, so eye injuries do happen when these children, they try to light the crackers, keeping their face very close, so very closely, and they try to do some mischief around. And sometimes there are some high projectile crackers also. They can come from nowhere around, and they can injure the eye as well. So once you have an eye injury, first thing is to wash the eye thoroughly. Then if there is any bleeding or any type of wound, just pack the eye and cover it with a soft cloth, or as well as sometimes you can get gauze pieces or pads in the medical shops. So just pack the eye, and kindly take the children to a nearest ophthalmologist or a pediatrician or a pediatric surgeon, so to assess the damage. So you should assess the damage of the eye. So most of the times, touch wood, they just go away by brushing the eye and causing milder abrasions so around the eye, or sometimes they may go and abrade the cornea as well. So most of the times, there may be minor injuries, but ultimately it is better to assess the wound, and if at all they may lead to a permanent damage, we have to identify and treat it accordingly. And so never ever take the eye injuries lightly, because they may sometimes go in for a permanent damage, and they may end up in having vision loss as well. So after all, we know it is really totally disturbing to see what type of damage these firecrackers can do. So word of caution is, like, better to avoid them. But even though kids, they don't like to be told to avoid these firecrackers, yes, we can allow them with certain prevention tips. So all of us should be aware of these prevention tips, and with these small prevention tips and do's and don'ts, we can have a safe Diwali. So first thing, as I told you, keep a safe distance. So there is no guideline you can understand to keep a safe distance. So always from the firecrackers, please, we can have a safer distance, and never keep your exposed face towards near the firecrackers, and always light the firecrackers with a distance. So better to use the long threads or long sticks, to incense sticks, to burn these firecrackers, but never keep your face and hands very close to them. And the second thing is, if at all there are some firecrackers which have gone dud, so please don't go and try to relight them. And they might sometimes be almost dead, but they may come alive again, so causing a really bad damage, because that time we are more close to them. So better avoid these firecrackers as well. And supervise the children always. So this is has there is no need to emphasize more than this, because supervising these children is the most important aspect, and it is a very, very important role of the parent. So every time I would suggest that better children can be observers rather than giving them to light these firecrackers. Though many children, they may not like it, but definitely yes, parents should fire the crackers and let the children, so with taking all care, but let the children watch it and enjoy them. So avoid crowded areas and chaos. It's a very important thing, because there are many instances. What happens is, both these children, they try to be in a crowded area, start lighting these crackers, and a little bit of chaos happens. Uh, they sometimes they overrun on them, sometimes stampede can occur, they may fall down, and these falling of these can cause a secondary injuries like fractures and other type of injuries as well. So better to avoid these crowded areas, have a specific area for lighting these crackers. So prepare a backyard or whatever over the in front of the house. So prepare an area where you can light these crackers in peace, as well as with uh, ample space. So, and also don't keep all these crackers what you are buying planning to fire at a single place, because sometimes, as we all see, there may be certain instances where a small light can go and catch up the fire in all these other firecrackers as well. We generally tend to see in the newspapers as well. So better not to keep these unburned ones in a safer place. So, and wearing an appropriate gear. So as I told you, never use a loose clothing. So loose clothing, what happens is, they have a tendency to get catch fire, get the attention of the fire without our notice. So better to avoid this loose clothing. Wear proper eyewear, that is round goggles or little bigger goggles, so that eyes are protected, and we can wear masks also to prevent these inhalational injuries. And the particular care should be taken for these burnt crackers. Never go and touch these burnt crackers and try to come in contact with them when they are hot. So better to avoid them, and you can try to uh, remove them once they are cold, and have a separate container or separate space for discarding all these burnt crackers, so to prevent these injuries. So as I already told most of the points, like, and there are few things which the parents should keep in mind when these children are having these firecracker sessions. So always have a fire extinguisher in handy. So you never know when this might help us and preventing major injuries and preventing major accidents as well. So and where certain areas where, like, some go downs or some other areas where they are more prone for fire accidents, please have these fire extinguishers ready. And always keep a bucket of water as well as sand in handy as well, so that we can, whenever there is some fire accident, we can immediately let out the fire. So as I already told, first aid kits, having a separate space for this uh, lighting the crackers and all. So it is a preparation beforehand, which should be done by the parents. So most of the do's and don'ts we have already uh, come across. So there are certain aspects where we can prevent these mishaps happening, especially by supervision itself. So most of the times having good supervision and following these small steps can have a safe firecracker sessions. So as we all know, before we actually, this is now the norms. Firecrackers, as you all know, previously most of the states, like in Delhi also, most of the kids have come forward saying that we need to safeguard our environment, so we should have a green Diwali. So ultimately, yes, for a green future, we should avoid these crackers. I know telling that is easier than preaching is easier than to practice. So because the kids, they don't understand, and they won't accept it. So better to avoid these crackers to safeguard our environment. So say no to these crackers, but when we are having or we are planning to burst these crackers, yes, definitely follow these steps as well. So have a happy and safe Diwali. Thank you. So we shall start with the question. So I have a question. How should parents handle a situation where a child has mild burn from a sparkler or Kia flame, Diya flame, and what are the immediate steps to ensure it doesn't worsen before professional help is available? Yes, it's an apt question. What we have to do is once there is a small burn with the sparkler, generally these are very small burns. That is, the extent can be very small, but it will be painful. So immediately wash this area with water and thoroughly for at least 10 minutes, and wash the entire chemical around the wound. And you can apply a small antiseptic lotions, and we can try to avoid any other further complications. I would like to welcome Dr. Yoga Nagendhar. He has joined us for the question answer session. So, Dr. Yoga Nagendhar, we had a good interaction session. So I spoke about what is the magnitude of the problem, and how to deal with the prevention aspects, and what are the different types of injuries, how do they occur, and how to prevent them, and if at all they do occur, and how to manage them. So now we are going ahead with some question answers, and before that I would like to ask you to enlighten some of these same aspects which come across during these firecracker sessions in your practice.
So, as Dr. Avinash told very clearly, I am Dr. Yoganagindra, Pediatric Surgeon in KIMS Cuddles. And as he said in the previous slide, the best prevention is try to keep the kids away from the crackers. But unfortunately, as good parents or whatever, we cannot keep the kids away from the crackers. So, as a good parent, actually, your responsibility is just be with the kid when he is taking the crackers around, because sometimes actually they'll just burn the crackers in an abnormal way, or as we know, actually they want to take the hydrogen bomb and just throw it. And unfortunately, this throwing also, sometimes it can happen that they might be throwing on some other child also. So for all these things, if parental supervision is there, we can prevent all these problems. So prevention is most important, and be it inhalation injuries, be it physical injuries, or be it collateral injuries, what we call. Sometimes what happens actually, while going away from the crackers, they'll just fall from the building or that parapet wall. So all these things actually can lead to fractures as well. Actually, it is totally unrelated, but it is an important thing that all of us should keep it in mind. So with this brief introduction, actually we want to wish you, all of you, a very happy Diwali and safe Diwali. And as it was mentioned very clearly, the moment a burn happens, the first thing that we should do is, as some people actually what they'll try to apply some oil, burn all, or some oil, but all these things are not correct. The first thing is reduce the heat. The only way to reduce the heat is by thoroughly washing it with water, running water. So the moment you put water over this hot area, automatically you're reducing the heat. So automatically, like Dr. Avinash told in the previous slides, from from third degree burn, it would have been a second degree or a first degree burn. So managing a first degree burn is like a cakewalk. Easily we can just ignore about it. But managing a third degree burn is very difficult. It can lead to contractures. Actually, it can lead to lifetime disfigurement of the body. So which we don't want for our child. So if you really love your child and want your child to be in a good position, try to keep the child always in a safe zone, and the only safe zone is when parents are around. So as a good parent, let us be with them. And few decades back, actually, once I got one small child, maybe some 1-2 years old, what we call it as ulipai bomb. So there will be a bomb actually where actually will be hitting out of the floor. So he just put, actually it is very shiny thing. Kids get attracted to shiny things. So they put the shiny thing in the mouth, and then he crushed it with the teeth, and it burnt actually literally actually all the stony particles actually they all fell there. It took a really long time. Actually, on a Diwali night, I had to spend 2 hours just to clean that muck. So that is one aspect, but what the child is facing and all, maybe you can understand by now. So let us see that actually we are around. That itself is the best prevention and the best gift that we can give to a child on a Diwali night. So
Sir, I would like to ask you what to do since we are all worried about eye injuries during Diwali. So it is a little gruesome injury, and no one wants the eye injuries. So what do we do if we have an eye injury?
So it's quite common that actually the particles can go into the eye, or the flames can go, or the fumes can go. So any of these things, actually, the moment it goes, it can lead to burn or a physical injury. So the first thing, actually, as a uh, first aid, what we are supposed to do is just wash it with cold water. And after that, actually, if next day also, if you still think actually the eyes are still watery, or if there is any blurring of vision, or if you can see something on the eye, actually immediately or same night, you have to rush to the eye hospital and meet an ophthalmologist and take the best advice, rather than doing something or just simply ignoring, telling that actually okay, in 1 or 2 days it will go away. So and sometimes actually the prevention for this is actually for those people who have specs, wear specs, eyewear. And if you don't have specs also, you can still give some artificial goggles for the kids, which can be a protective eyewear and which can protect. The prevention is the best, especially in this Diwali time.
So any questions we can take? So how should parents handle a situation? Yeah, I think we finished this question, like how to handle for a burn. And yeah, second question is, if a child has suddenly scared or anxious because of the loud noise around them, so what are some immediate actions parents can take to help soothe them and protect them, their hearing from potential damage? So I think, as I already told, yes, loud noise can be disturbing, mainly for smaller children and the elderly or labile groups. So better is to take a preventive action as well, like cover their ears before any bombs or anything, these firecrackers explode. So have them a protective ear buds or anything, and that is the best way. And assure them that nothing's going to happen. Yes, definitely they will be little anxious, and just make sure that take them to their to your go to the child and make them tell them that nothing's going to happen, and that should be done.
So for to add to that, actually, for every hearing ear, normal human hearing ear, there is a safe limit for how much of decibels can our ear accept. So the normally accepted level of decibels is 85, but unfortunately, some of the latest new generation bombs are really having actually more than 85 decibels. So the best thing is stay away from, actually maintain some distance. So actually kids know how to make it a time convert it into a time bomb. Actually let them do it. So after that, actually automatically we'll try to go away from that, and then automatically the ear will not and eardrum will not be suffering from the high decibels of injury, actually which these natural bombs actually crackers will give. So maintaining the distance is the most important key. Prevention again is the key. So try to stay away from the bombs. And fumes also, actually, as Dr. Avinash told, try to stay away from the fumes. And what my advice actually we can give, actually, it was dealt in the previous slides. So try to maintain some gap between the bombs also. So maybe something like a bigger bomb and a smaller bomb. Smaller bomb won't give lead to or something like a rocket in between or something like that.
Try to mix these
mix and match. So kids, they continuously, especially boys, very scary. They always want all types of weird, big bombs, but don't fall in their trap. So in between, actually, as a good parent, you can just do something, some jadoo you have to do, and then bring the child out of those bomb cracking thoughts. So, and that's why actually maybe our, according to our Indian mythology also, we have actually 5 days after this, actually we have Naga Panchami. So when we will be doing that uh, cracking the bombs again, means that in itself our ancestors, they have told, you need not do a whole thing in one go, actually give it a break. So keep some for the next day or next year also, it's okay.
Yes,
or we have so many occasions, some birthday, some functions, then you can really enjoy. So don't do everything in one go.
Yes, definitely we can decrease the risk of exposure and risk of mishaps happening. So
regarding the safe eating practices during the festivals, and with this festival especially, and
how should they respond if a child starts choking?
So regarding the feeding practice, I will talk. Feeding, what happens, actually, kids, they're very notorious. The moment they see a nice sweet or something like that, in between a tiresome bomb cracking episodes, they may put the hand on that sweet, and then they'll try to eat, which is very dangerous, because actually all the time, actually continuously, some explosives, some chemicals which are released from that are on the hands of the kid. So that's why, as a point, actually usually the mother actually tells, come up, then only I'll give the food. Second thing she will tell is, don't eat without washing your hands at least twice. And she will immediately tell, remove all the clothes and then wear new clothes. That is, these three things are usually, actually, we see in our daily practices. So follow these practices, and then you will be having a safe journey of eating practice also. Regarding the choking, I wish Dr. Avinash talks.
Yes, before the choking, I would like to add, sir, one of my experiences with a colleague. So what they were telling is they see a lot of camphor ingestion during these festive seasons. Like a lot of pujas are going on, so there are a lot of camphors in the house. So most of the time, these children, they tend to eat these camphors, causing poisoning. So parents should be very careful and keep all these away from the children, and so that they don't fall into these things. So yes, choking, yes, definitely, because children are in a hurry, and they try to not swallow completely and not chew them properly. So always make sure that they are not in a hurry, and keep them calm before they start eating, and ask them to chew the food properly. Yes, if choking happens, then there are certain type of procedures like Heimlich's maneuver, where you try to get the baby upside down and give thrust at the chest level, so that whatever the choked material is there, and it comes out from the mouth, though it is rare, but yes, small thing to be kept in notice by the parents.
As he said, actually, Heimlich's maneuver is a very important maneuver, and it can come into some basic life support that actually we should teach. We'll try to do it in our next session, where usually, actually, the person who is assisting, actually, they'll be keeping this fist, and they'll be putting actually at the lowermost part of the chest, and then they'll be giving an upward thrust. The moment the thrust is given, actually, whatever is there in the esophagus and which is choking will just pop out. It is shown in some of the movies also, actually. So these things actually are important basic life supports. We'll deal in our next session.
So how can parents ensure proper hygiene and take precautions to keep their children healthy during these crowded festivities? Yes, proper hygiene, yes, definitely. And before they they start their food. So proper hand washing is one thing which they have to follow. And during the cracker sessions also, they should make sure that the children wash their hands thoroughly, and before as well as after the food. And try to change clothes frequently, because there's a lot of exposure for these harmful chemicals, harmful fumes, and these toxic substances which are around during this firecracker session. So make sure that the children are wearing a different type of clothes at each regular interval. So get hydrated as well, because most of the time during these festive seasons, children tend to avoid good intake of water, and they are more into this playful mood. So make them hydrated, and give them proper nutrition, and follow these safe practices to have a safer Diwali.
And regarding this crowded festivals, I have a suggestion. So whenever we are trying to do some lighting of some crackers, so family should enjoy. It's not an individual person's enjoyment. Usually boys do that. They'll just keep on doing that, cracking that bombs only, and in their own world. So it is not like that. Actually, let all of us be there. Let full family enjoy one cracker at a time. So that way, full family will be enjoying, and we are watching. One parent is able to watch all the kids. So usually in a family, it is a family get together. So many kids will be there. Maybe one or two parents will be there. So maybe that might not be enough to give one-on-one attention. So let us have one cracker at a time. So that way you'll be enjoying the festival mood also.
So there is one question: what should be done if children accidentally ingest rangoli powder or other decorations?
Nowadays, luckily, we have most of them are eco-friendly,
organic,
and healthy, organic rangoli powders. So my suggestion to everyone is try to use those things only. Though they may sound a little bit costlier, but because by using cheaper alternatives, actually we'll be using uh, some cheaper ones, but those will be causing skin damage. Those will be causing actually so much of by ingestion also it can lead to chemical damage as well. So the prevention again, use eco-friendly items, and try not to use too much of these items also. Something natural, something like what we use for regular rangoli, that only we are supposed to use. Regular, what we call in Telugu muggu podi, that thing only is better than using actually multiple colors. And what is natural is always better.
So even if they consume, most probably they'll try to consume little bit, seeing the different types of colors. Just one thing is to avoid exposure to that. So immediately wash the mouth. Don't try to induce anything, vomiting or anything, because sometimes they may go into the lungs. So most of the times we have a safety protocols and toxicology protocols also. So when these powders are taken, just try to wash the mouth and give thorough. And we have to watch for symptoms. Most of the times they may develop vomiting and lose stools. So if at all it is just the symptomatic treatment we can give, and most of the times it can be managed. Are there child-friendly fire extinguishers or safety kits for Diwali? Uh, Fire extinguishers are of the same grade, whether it can be for children or adults or whatever, for a different type of situations. Yes, as I already told you, during these firecracker sessions, it's better to have a bucket of sand as well as bucket of water to be in handy. And yes, definitely more prone areas to have big fire extinguishers where the parents can only operate them. So better to keep these in handy. And safety kits, yes, these are all the safety mechanisms which we can have, and try to have these around during these firecracker sessions, and we can have a safe Diwali.
And always maintaining one fire extinguisher at home is always a good practice. Nowadays, smaller versions are there which are safe, and maintain one at a home. It's always safe.
I would like to ask, sir, like there's a question: how can we help children understand Diwali's significance beyond crackers, firecrackers?
So, unfortunately, nowadays it's more of a nuclear family concept, whatever might be the reason. So, but if you really see, the teacher or the important person who's going to tell about all these things are um, grandparents. So grandparents tell us actually what is the significance of Diwali, why we should do actually puja, and after the Lakshmi puja is over, actually from the light from the our puja room, then light will be taken as the first agarbatti or first candle. From there, actually they will be starting the crackers, and after finishing everything, and there will be a family get together, and then they'll be washing their hands, changing the clothes, and come back again. They'll be having a friendly family dinner and all these things. And why we are celebrating, actually as parents, it's our responsibility to tell the kids it is not only bursting crackers or something, it is something more. Why we are cracking, why that amavasya means that new moon day where there is no moon on that day, why that day should glow with the light. It's the beauty of the light, that why light should come into the lives of those people who are being suffered by Narakasura those days. So all these things actually we have to tell. It means mythology is a little bit more about actually the teaching the good practices to kids, and we have to teach as good parents. So kids should understand even on a dark day, dark night, so much of light should be there filling our lives. So let us celebrate our Diwali very well, and wish all of you a very happy and a safe Diwali crackers bursting event. And after that, have a lovely family together time. And our phone numbers are there. Our helpline number will be there anytime, any day, even the Diwali night also. If you have an issue, you can just text us or reach to us. We'll take care of your problem and we'll give you the right option and right solution. Thank you, Dr. Avinash.
Thank you.